Ladies and gentlemen, welcome to my channel, Nursing Education Tutor. My name is Cheryl Spencer. In this video, I'm going to talk about advanced directives, and I'm going to talk specifically about 5 key things related to advanced directives or examples of advanced directives. Those things that I think a nursing student or even an entry-level nurse, perhaps even a layperson who happens to be watching this video, having an understanding of those 5 key things related to advanced directives. 1, they can understand what advanced directives are. 2, they can understand what these instructions are for the patient, as well as decisions that the healthcare professional may need to understand. So let's start from the very beginning. What are advanced directives? Everybody has a definition, but in a nutshell, advanced directives are instructions, whether written or in a digital form, that a client, a patient states their wishes of what they want to be done regarding their health care in situations where they're not able to. And that's the key part about it. Advanced directives are here. They exist, but as long as that patient can verbally state or written state their objectives, advanced directives are kind of like a plan B. We're gonna hold on to them. We have access to them. We know they exist, but we will only use them in those situations where the individual cannot make that decision for themselves. Advanced directives. So in the conversation of advanced directives, I'm going to start with number 1. So the first thing I want to talk about is CPR, cardiopulmonary resuscitation. Healthcare providers, nurses, doctors, physical therapists, EMT, police officers, firefighters, all those first responders, they all take CPR course. They have basic life support. Some have advanced cardiac life support for kids and adult. But basic life support, basically when I talk about CPR, it's what do you want done in the event you have no palpable pulse, no spontaneous respiration, your chest isn't rising. Do you want us to begin manual compressions to try to send blood around to your body? CPR, it's an emergency response that you make a decision if you want done. So CPR is a conversation that healthcare providers, patients, their family members should understand with regard to advanced directives. Now, on the other spectrum of CPR, there's an advanced directive called a DNR, do not resuscitate. So do not resuscitate means if in the event you are found with no palpable pulse, no spontaneous respirations, you just want us to leave you alone and let you continue the rest of your spiritual journey. You do not want us to revive you. That is a do not resuscitate. Now in healthcare, there's a conversation that we must talk to our patients. Just because you signed a do not resuscitate, it does not mean that we're not going to treat you. And that still exists where some patients may be reluctant to sign that, but the healthcare provider, be it a physician, a PA, nurse practitioner, or bedside nurse, or even a social worker having a consultation, should try to explain to this individual that a do not resuscitate means just that. In the event you do not have a palpable pulse, spontaneous respiration, no signs of life, we're not going to resuscitate you. I want to transition to something around that same area of do not resuscitate, and that one is called a do not intubate, a DNI. It's a little bit different. So for instance, here's where DNI would be appropriate to have a conversation. Let's say you have a patient who is in distress, in respiratory distress. I don't know, gunshot wound, left side, atelectasis, or severe congestive heart failure, and we've exhausted all the Lasix that we can use, and the only thing that the healthcare team wants to use now is to put this person on a mechanical ventilator, meaning they would have to intubate you to put you on that. If you have a do not intubate as part of your directives, in that instance you would not be intubated. So it's really important to understand a do not resuscitate means if you have no signs of life, we're not going to do CPR or any other emergency measures. So leave it at is. Do not intubate is if you don't want to be put in a ventilator under any circumstance. So that's CPR so far. Do not resuscitate and do not intubate. Let's talk about a healthcare proxy. Now, healthcare proxy is one of the quickest and easiest ways that an individual can state what they want their healthcare needs or treatment to be in the event that they can't. So a healthcare proxy is a document that you, the individual, in your sound mind, competent, appoint someone to be your proxy to make those decisions for you when you no longer can. Let's give you an example. You're 25-year-old female, you're single, so your next of kin would be your parents if they're living. Let's say you believe that your parents would be too emotional to make a life-altering decision in the event that you can pick someone who knows your wishes, be it your friend, BFF, bestie, someone you trust to make those decisions for you. And it's an important decision. So we, as the healthcare team, we talk to you. Take this decision seriously. Have a conversation with your proxy. If, for instance, you know under no circumstance do you ever want to be put on mechanical ventilation, please have that conversation with your proxy. Have a conversation with them about feeding, about if you need to have a feeding tube, any type of life sustaining treatment. So that's a healthcare proxy. A living will. Most times in a conversation about a will comes up, it's usually after somebody dies. It shouldn't be. It should be a conversation you have before to make sure that your will is appropriate. But most conversations about a will, it's usually related to what a person wants to be done, divided their assets after death. So, but a living will is something that's used while the person is living. And again, as mentioned before in the general overview of advanced directives, a living will helps direct a client, patient's healthcare, again, in those instances when the patient, person, client no longer can. Lastly, with related to advanced directives, I want to talk about something that you may see called a MOLST, M-O-L-S-T. What a MOLST is a document. It's called MOLST, Medical Orders for Life-Sustaining Treatment. In recent terms, with the use of the term provider, some places will call it a POST, Provider Orders for Life-Sustaining Treatment. Same thing. I teach students to look at a MOLST as a container, a bucket, cute little pocketbook. It's something that you keep key things, not too many things, but important things. So what's on a MOLST? First page of the MOLST, of course, it identifies who you are, etc. A MOLST, there's going to be a checkbox whether or not you want CPR. And again, the conversation about CPR, you should consider if in the event you're resuscitated and require mechanical ventilation, do you want that? You can also state that on a MOLST. Another section of the MOLST is going to talk about a DNR, another directive, do not resuscitate. And of course, do not intubate, DNI is also going to be there. Do you have a living will? It's there. Who is that person? How do we contact them? Do you have a healthcare proxy? Who is that person? How do we contact them? Most healthcare proxies have two proxies. Proxy number one that we call first, and in the event that we can't reach proxy number one, we call the secondary proxy. If you happen to be, if your client rather, patient, resident, happens to be in a long-term care setting or any type of post-acute care setting, on the MOLST is going to have something called a DNH. Do not hospitalized. So consider this scenario. 85-year-old patient in a nursing home. When they're in a nursing room, they're called residents. Let's say the patient determined, I'm 85, I understand my health condition. I understand that it is chronic. I understand that this is where it's going. In the event I'm in distress, I do not want to be sent back to an acute care setting or a hospital. That's also stated on the most. I think that's about it for now. So again, advanced directives, 5 key terms that any nursing student or entry-level nurse should understand to be able to direct a patient and assist the patient. So CPR, cardiopulmonary resuscitation, DNR, do not resuscitate, and DNI, do not intubate, healthcare proxy, and the most, I think I ended up talking about 6 things. I added a living will, which is important, okay? So ladies and gentlemen, again, I hope this helps. If this is your first time to my channel, welcome. I hope you stay. Have a good day.